Welcome, everyone. Thank you so much for stopping in today. My name is Dr. Jonathan Kalin. I am a licensed acupuncturist who works with Align Modern Health. We have roughly 18 different locations throughout the Chicagoland area, and we are talking today about allergies, understanding allergies and an alternative approach to treat them. What Align does, that is chiropractic medicine, acupuncture, clinical massage therapy, and functional medicine. Chiropractic care does a really great job of alleviating any musculoskeletal complaints, anything like backaches, sciatica. Honestly, a fun anecdotal thing. I've honestly benefited from all aspects that Align does here. I actually personally suffered a car accident one of my first years through medical school, and I attribute my fast and rapid recovery to chiropractic medicine. Again, we also have clinical massage therapy, also great. Any aches and pains you have, muscle soreness, anxiety, and stress, super awesome for that as well. We also have functional medicine and clinical nutrition, which does a real deep dive into what we have going on. A really good focus on GI gut health, deep dive into labs, and really getting to know you and your unique condition. Now, acupuncture today is what we'll be focusing on. That would be my specialty. We do work with stress, anxiety, muscle tension, men's and women's health issues, fatigue, headaches. We have a lot of different modalities that we use, which is acupuncture, herbal therapy, cupping, massage. It's really a whole package and kind of fits really great alongside everything we do here at Align. We really take a holistic whole person approach. We integrate amongst ourselves and essentially just about anything you'll want and need that is not prescription medication or surgery. Not that there's anything wrong with that, and it has its place, but we want to focus on getting people well with as minimal invasiveness as possible. Now, again, my name is Dr. Jonathan Kalin. I am a licensed acupuncturist. I spent many years with education. I have my doctorate in what I do, traditional Chinese medicine, which I got from Pacific, which is here in Chicago. I have my master's in traditional Chinese medicine, that's acupuncture, herbal therapy, the works. Got that over in National in the western suburbs of Chicago. I'm also NCCOM certified and a member of multiple groups that support acupuncture, both here and also in a more global capacity as well. I'm also a trained massage therapist as well, and I kind of throw a little bit of everything together. So a little bit about me. I grew up in the Pacific Northwest. I grew up with a lot of this East Asian information and philosophy. And for me, I actually got my starts through massage therapy, where I had and was treated with acupuncture for allergies and allergic asthma, a great topic with today. So for me, it's actually something I'm very passionate about. Got great results, and currently, as per what's going on, is I functionally don't have any sort of asthma whatsoever. I don't rely on an inhaler anymore. So everybody's results may vary, but speaking of a personal experience, great stuff. We'll go back our page. Now, what are allergies? They are essentially our immune system's response to substances, otherwise known as allergens, by producing antibodies which are designed to neutralize these pathogens. Essentially, our body has a histamine response that causes permeability in our cells and permeability in our vascular tissues. That's part of what kind of causes some of that swelling that you can also experience with some of these allergic reactions. Now, in the case of most allergies, our immune system recognizes allergens as harmful, even though that's not typically the case. Oftentimes and normally, everything's fine. The body goes, check, everything's fine. But in some cases, in the cases of allergies, autoimmune conditions, the body goes, whoa, I don't recognize this. This isn't a part of me, must attack it, even if it's something that's not really harmful. Now, some of the most common types of allergies that we have are going to be food sensitivities, allergic reaction to pets. Often this is saliva or dander. There can be allergic reactions to insect stings and bites. or allergic reaction to various medications and drugs, as well as sensitivities to things like mold and mildew. There are also allergies to various plants, metals, latex allergies. There's a lot that we're exposed to on a daily basis that can definitely have a bit of an impact on that for sure. Now, in regards to how the body works with that is, again, it's mostly just the body kind of misbehaving in regards to our immune system. Now, common allergy types, those are going to be, and what those responses are going to be respiratory. It's a lot of the breathing kind of complaints. We have topical reactions like rashes, itchiness. We also have internal complications. Occasionally, we can have swelling and inflammation, wheezing and breathing problems, or even GI upsets or headaches. Now, what causes them? That is kind of still up to debate. There's a lot of research that's been coming out about that. And again, it's really not clear, but we're working at it. Now, in regards to those allergies, there is some genetic components, but specific allergies like shellfish, for example, are not necessarily passed down. Some can be required, some come, some go. They still don't entirely understand why allergies can pop up and then disappear, or vice versa. Now, instead, each of us have unique triggering factors that kind of create and cause some of these allergies to pop up. This can be factors happening with the outside world, leading to some internal imbalances inside of our bodies. Stress can be a huge factor since that greatly impacts our immune system, our sleep, which is kind of how we recover from everything. Also, our diet. Again, our GI has a huge component to do with our immune system. In fact, most of our immune system actually kind of comes from our gut and how that works as well. Again, a great thing to talk to FM about as well, functional medicine we have here at Align. Again, doing a really deep dive as to how that interplays to our overall immune system as well. Now, one other type of allergic reaction that we definitely need to talk about, and that's called anaphylaxis. This is an emergency call 911 kind of reaction. That's very severe, often kind of causing issues with breathing, shortness of breath, decreased blood pressure, loss of consciousness, nausea, vomiting. It's not a pleasant day to have for sure. So absolutely, anytime someone experiences anaphylaxis, this is call 911, get them to the hospital kind of situation. Oftentimes, this is when you see things like EpiPens and why someone would carry an EpiPen. Essentially, it's just a life-threatening response that can go into shock, which is, again, very, very significant and severe. Now, also to go a little bit of background with how allergies and how everything interacts with our body itself. Often people normally associate allergies with our respiratory system. We have our sinuses, which are both up here, which most people think about. We also have sinuses here underneath the eye as well, where you can kind of feel pressure besides the nose, the eyes. We also have posterior areas behind our nose as well, which can get clogged and congested. Kind of the idea where you feel like your nose is open, you can breathe, but you still feel that pressure and congestion in your head. That's often our posterior sinus area. We also have eustachian tubes, which connects to our ear, nose, and throat. That's why we have ear, nose, and throat specialists. That also interplays with that system. Those can get feel pressure in those kinds of areas. We also have within those structures of our nose what are called turbinates. Those are structures that help keep everything moist and make sure everything is considered filtered moist. There's turbinates and soft tissue that kind of hold everything in there and kind of allow us to function and breathe. And essentially, when we have congestion, when we have an allergic reaction in our sinus area, those areas swell, and that's what makes it so we have issues breathing. Now, some of the things that we use, or some of the things that Western medicine uses to alleviate some of these allergy symptoms, these are things like antihistamines, corticosteroids, decongestants. There is also immunotherapy, which are injections that are done over time to acclimate yourself to some of these offending allergens. Again, touching base on epinephrine, which are EpiPens. That's again often used for these anaphylaxis reactions. But again, today we are focusing on alternative care, specifically the East Asian approach. We'll be touching base on acupuncture, herbal medicine, as well as diet and lifestyle modification. I also want to take this time to bring up to you guys about some recent information that was broadcast from the FDA as really only a few days ago, and that actually has to do with over-the-counter allergy medication, specifically for decongestants, in regards to the phenolphthalein or phenylephrine. Allergy medications has been shown to be ineffective at the current dosage. And again, that was from the FDA. You can find it on CNN as a current article. We really like to take a whole body approach in regards to that as an alternative to some of these decongestants that don't work. Now, again, the information does still support the use of nasal sprays and things like that that do contain the pseudoephedrine, as well as some of the other decongestants out there, like pseudoephedrine, are still shown to be effective, but specifically the over-the-counter common medications used for nasal decongestion, the phenolphthalein, has not been shown to be effective at the dosages that we're currently given. Now, focusing again on acupuncture as an approach, it is patient-centered as opposed to a disease-centered approach to care. We focus on identifying root causes to challenges and treat them to restore balance in the body. This is accomplished through hypercific placement of ultrafine filaments into the body, very super fine, super tiny needles. This works through many different factors by stimulating the current idea is that it's stimulating nerves in the area, hormone production, and as well as movement and blood flow within the body, kind of affecting overall homeostasis. The idea is everything kind of in balance and in equilibrium, otherwise known as, again, homeostasis. Now, people often ask, does acupuncture hurt? The idea is you might feel a little bit of a pinprick, but really shouldn't be any sort of lasting discomfort. These needles are smaller than a cat whisker, super tiny. You can fit 10 of them into what you would normally associate with a regular needle. Now, on to herbal therapies. That's going to be formulas, which are time-tested combinations of carefully selected herbs. These work in various ways to treat underlying health concerns that often essentially go to patterns which then give rise to some of these symptoms that we experience. Things like supplemental aspects, that would be resource production, similar to, again, nutritional supplements. These herbal medicines gives resources to our body that they may be lacking, and things that you're in a specific person may need. Also, taking a more direct approach, there is freedom from obstructions including blood, mucus, lymph, our nervous system. Think of breaking through that sinus congestion or acting kind of as an antihistamine does to combat an itchy rash. I've actually had personal experience with some of the formulas that we have and works for decongestion. It's amazing. It works great. It's great stuff. A few of the ones that we work with are branded as Numa, which helps with wheezing and shortness of breath that we might kind of experience with allergies. There's Restore, that's all based around building nutritional deficiencies and aid in immune support. Xanthi, which clears deep, difficult to expectorate sputum from our sinuses. Think of it as like really intense, deep sinus congestion. Amazing, works wonders. Grace and Ease is all towards balancing our body, settling our stress, and aiding with digestion. We also have Base Camp, which is all about strengthening our immune system in a holistic, whole way, and also it benefits from various mushrooms as a supplement towards or ultimate tonification. There is also Allergy, which strengthens our immune system as well. Those are all supplies that we have here at Aligned. Now, moving on to diet and lifestyle modifications. Some of the ideas are avoiding cold foods, salads, raw vegetables, cold drinks, ditching that ice. Room temp is usually the best. Also, to add to some of this is if you are lactose intolerant, try to reduce some of our aspects of dairy. Kind of some self-explanatory things, but makes huge important life changes. And also with us coming into some of the colder months, integrating some supplements and spices that we might have in our spice cabinet, like ginger, cinnamon, nutmeg, cloves, a lot of our fall time spices. Awesome, great for allergies as well. Eating with the season, our bodies reflect our environment. So in the summertime, often you'll find like tomatoes, green onions, eggplant, whereas fall is all about pears and gourds. And that's why we do pumpkins for Thanksgiving time. Now, incorporating balance and building exercises as well can happen towards total body wellness, being yoga, tai chi, qigong, as physically balancing and mental balancing are one and the same. And that's a big part of how acupuncture works is our mind influences our body, but then our body also influences our mind. My name is Jonathan Kalin. I appreciate so much for coming in with us today. We will have a short Q&A session as well. After this, we accept all major insurances in the area. If you have any questions, again, please throw that into our Q&A and I will answer them as they come in. Perfect. We got at least one question through here, and that is, what is the difference between acupuncture and dry needling? Honestly, that's a great question. I personally would see dry needling as a type of acupuncture itself. Dry needling focuses on neuromuscular reaction specifically to a muscle group. It is a single needle insertion into a muscle, which causes what is normally considered a fasciculation or muscle skip, which then causes the muscle to relax. The needles are not retained. There's no overall holistic focus towards how that all works. But again, dry needling is actually something that is a part of acupuncture and is within our toolkits. Next has a question about working with kids of different ages, and absolutely, we can definitely treat people of all ages. We have some other questions in through here. Someone having sore throats with allergies. Anything to soothe that other than lozenges that are meant for colds? That actually might be a good question to have a 15-minute consult as we have in here. We can definitely have some, direct information about that as well. Some United Healthcares definitely do cover acupuncture. It's something that, what I would recommend doing is actually giving us a call. We can do a free check or free verification of your insurance. Someone having a question about acupuncture as its treatment for asthma. Again, this is all for informational purposes versus it being like direct medical advice per se. I personally have benefited from acupuncture to help with asthma-based symptoms myself. It can definitely help with some of the overall symptoms of asthma, and it can be used in a treatment plan to assist with any of those asthma symptoms. Let's see. All right. Someone also had a question about diet and lifestyle modifications in regards to raw veggies, salads, and why we kind of recommend that. And the reason why we often stick away from over raw and some of those unprocessed vegetables and in that way has a little bit to do with how our body responds to these. Often paraboling our vegetables, like a slight blanching or slight boiling, actually makes it easier for our body to process. It breaks down some of the constituent ingredients, and that ultimately kind of makes everything a little bit easier for our body to process. So it's less of a shock on it. Now, someone also had a question about how often in a month is acupuncture required for allergy relief. That is honestly a great question to come in and see us. We can definitely, discuss something like that more in detail, since that is going to be a unique approach, an individualized approach. Often I've seen some pretty good results coming in once a week for that myself. But again, that can entirely vary. In regards to presentation slides, absolutely, this is recorded, and definitely everything can be available afterwards. Are there any superfoods to help with allergy symptoms? Absolutely. Often people consider blueberry as a superfood. It's also a natural anti-inflammatory. Great, amazing berries are good all year round to kind of help with our overall body and to help with inflammation within it as well. Someone sent out a question, and that's a very good question about seasonal allergies that they have, but they don't have them when they remove dairy. Essentially, what can kind of happen is their body has a histamine response. So we talked about it earlier. It's a part of the allergic reaction, allergic response. If we are functioning at a higher rate of alarm, which is the higher levels of histamine in our body, we're going to be more reactive. So essentially, the body's already at alert and is going to attack immediately something that's going to happen versus us being kind of relaxed and going, okay, I guess this is all right. So what happens is those allergic things might still be an allergy for you, but there's going to be less of a reaction because there's less of a baseline inflammation state. The supplements that you have are things that we have here at Align Modern Health. You can absolutely get that by coming in and seeing one of us. We'll go ahead and give a moment for any more questions that we might have. You're certainly welcome. Other spices to help with allergies. Again, a lot of fall time spices are especially good. Again, cinnamon is great. Clove is great. Pepper can be good in moderation. Turmeric can be good, depending. That can actually also vary as well. Great for anti-inflammatory properties with that, but again, that can absolutely vary. Actually, yes, that is a great question. Someone just asked if lymph nodes can be affected with allergies. Honestly, they absolutely can in regards to any sort of inflammation that we have within our body can affect those lymph nodes. Overall, systemic inflammation and swelling can put pressure on these lymph nodes and the lymph vessels themselves, causing clogging within the vessels and then leading to inflammation within the lymph nodes themselves. So I have actually seen lymph node swelling with allergic reactions as well. So that absolutely can be effective. Keep them coming.
Thank you so much, Dr. Kalin. I do think this brings us to all the time that we have for today, but anybody that would like to continue this conversation, we will be having an Instagram live session next Friday at 12:15 p.m. And then our next digital doc webinar will be the following Thursday. Thank you so much for joining us. Thank you, Dr. Kalin, for your time.
All right. I'll actually go ahead and answer this this one last question. We do have just a quick moment here. Someone having an action to really hoppy beers. They really like the hoppy beers. Sometimes people can actually have a reaction to, sometimes it's the brewer's yeast that's involved with that. That's something that I would actually very much recommend seeing one of our functional medicine doctors about, and maybe even screening for potential reactions and allergens to those specific ingredients. It's not the end all world. There are options out there to help with that. But they can definitely help, deep dive to figure out if that's going to be a direct reaction or if that's what you are specifically responding to within that year. But again, thank you so much for coming in and tuning in with us today. Take care, and we'll catch you next time.